another episode of Talk Nurse with me. Today we will be doing a deep dive on advocacy in nursing. So if you are interested in that topic, then just keep watching. We're going to get into our wine highlight first. So today we will be drinking liquid Popsicle. It's a sweet red blend, $6.99 from Total Wine. The flavor profile is described as berries with fruit aromas, and the alcohol content is 13%. So I'm very interested to see what this tastes like, especially since the alcohol content is so high, but it still claims that it is like a sweet red wine. So we will see, like, is it or is it not? I'm not gonna pour too much today because she's trying to be healthy. So, you know, we'll just really taste it in a little sip. Wow, it's actually true to its name. It actually is still very sweet while maintaining the alcohol content of 13%. I'm pretty shocked because it's just like normally when the alcohol content is higher, it makes it more bitter, but that's not the case with this one. So if you are into sweet red wines and you want a good alcohol content, definitely check this one out. This flavor that I'm drinking is Sweet Red Rubylicious. So if y'all are interested in trying that out, that's what I'll be sipping on for today's episode. And we're going to get into what would Lainey do. So today we're going to be talking about, do you talk politics at work? And my answer to this is yes and no. Have I talked politics at work before? Yes. Will I bring up politics at work? No. Because quite frankly, I don't want to talk about it. So let's get into this. This is going to be like in regards to patients. I'm not discussing politics with my patients. If most of the time I'm working day shift now, so they're watching the news or something on TV, they'll have their little say so on what they think, what they believe, and et cetera, et cetera. And I'm just kind of not really answering or entertaining whatever they're talking about. It's just like oh, okay, or like yeah, you know, it's not like me going into an in-depth conversation with them. Politics can be a very touchy topic for some, and especially when Trump was president, it was even more so like very sensitive topic, and I'm not trying to get into that with my patients. I'm here to take care of you, and we could talk about other stuff like what are your hobbies and etc. like that. But as far as politics, I'm good on that. So that's where I stand in regards to patients. Now with the yes part, when I was discussing that I do sometimes talk politics at work, is more in relation to my coworkers. Sometimes they might say something that a patient had told them and we'll discuss it. Or I've had it, especially when Trump was president and all this stuff with Governor Abbott and what we think about him, stuff like that. That got brought up quite a bit at work, just more so people seeing information and being like, oh, hey, this happened. Did you hear about this? Or stuff like that. And then we would discuss it. Now, it really just depends on who the coworkers are. Most of the time, I'm really not trying to talk to you at work unless like we're really cool. And on night shift, I would say I more so talk politics more because we have more time like to sit and discuss things like that in depth, especially between like 12 and 4 o'clock in the morning. So like me and Kelsey would talk about stuff all the time, but I'm closer to her than most of my other coworkers. And then we did have another coworker. I don't even know how he would bring up these topics, but we would discuss it with him as well, pretty in depth. And just to get like an idea, a different perspective of what he thought about things and things of that nature. A lot of the times when we do talk about politics at work, it's kind of brought up because it's a healthcare related issue going on. Like politics and healthcare is pretty closely related. Even with the pandemic, with how Governor Abbott like decided like that COVID patients had to have visitors. So what the hospitals had to do was change how they do stuff and have the attending be the one who made the decision whether or not it's appropriate for the COVID patient to have a visitor or not. So it's just like a lot of stuff that goes on in office does affect us. So sometimes those like those conversations are brought up. Another example of that is like the abortion stuff that happened with Governor Abbott, how he like banned abortions. So it's like a lot of stuff is closely related. Even now, with the whole the Supreme Court, or people bringing stuff to the Supreme Court trying to cap travel nurses' pay, like a lot of stuff really does affect us. So that's primarily why we discuss it. And then sometimes we'll kind of just go down the rabbit hole. So yes and no. Like I said, it's a very sensitive topic for some. And I feel like if you can't maintain objectivity with people, with knowing where they stand in politics and what their beliefs are, then maybe you should not discuss it at work. But I feel like if you are able to be open-minded and hear other people's perspectives on the matter, then it's no harm in doing so. I would not discuss politics with patients just because I don't want to say it can ruin the nurse-to-patient relationship, but it might change the dynamic, not because of you, but maybe because of them. I don't know. So that's what I think about that. You guys let me know down in the comment section, what do y'all think about talking politics at work? Are y'all here for it, or are y'all not here for it? Or are you kind of in between like I am? Let me know and we'll chat about that down in the comments. And now we're going to get into advocacy in nursing. So I pretty much have this whole, episode kind of laid out somewhat. So we'll begin with the Merriam-Webster definition of advocate. So we're all on the same page on what an advocate is. Pretty much, I guess, the root word of advocacy. So an advocate is a person who speaks or writes in support or defense of a person, cause, etc. So now I want to get into attributes of patient advocacy. We'll be breaking this video up into like multiple parts, because I think most of the time when people think of advocacy and nursing, they're thinking more so the nurse to patient relationship, but you can also be an advocate as a charge nurse in relation to your staff nurses. And I'm only speaking of perspectives that I'm familiar with, that I have experience with, but you can also be an advocate as a manager to your staff members. But I don't have experience with manager type leadership roles, so I'm not going to be discussing that in detail. So I'm going to discuss what I've seen and experienced in the nursing world. If you guys are managers and you have any input on what that looks like for y'all go ahead and comment that down below. But like I said, I'm going to be talking about what I've experienced in my personal perspective on things. So you have the nurse to patient one, which is the one that most people are familiar with or think of. You have your charge nurse to staff nurse. You have your advocate, like you advocating for yourself. So that's another one. So we're going to start off with attributes of patient advocacy. So I actually got this that I'm going to read to y'all. I got it from pubmed.gov, and I'm going to be reading it verbatim. I'm going to put it in the description box in case you guys are interested in that article as well. It's called Patient Advocacy in Nursing, a Concept Analysis. So I was just kind of looking at different stuff just to see what did other people think and whatnot. And I saw this definition, or really explanation of patient advocacy, and it basically covered all of what I was going to talk about. So I definitely wanted to bring it to the episode because they kind of framed it probably a little bit cleaner than I would have. So I'm going to read that off in just a second. Like I mentioned, this will be in the description box, so I'll put the article there in case people are interested. But they described attributes of patient advocacy as safeguarding, which can be tracking medical errors and protecting patients from incompetency or misconduct of coworkers and other members of healthcare team. Apprising, which is providing information about the patient's diagnosis, treatment, and prognosis. Suggesting alternatives of healthcare and providing information about discharge program. Valuing, which is maintaining self-control, enabling patients to make decisions freely, maintaining individualization and humanity, maintaining patient privacy, and acting in the patient's values, culture, beliefs, and preferences. Mediating, which is a liaison between patients, families, and healthcare professionals. being patient's voice and communicate patient preferences and cultural values to members of the healthcare team, and championing social justice in the provision of healthcare, confronting inappropriate policies or rules in the healthcare system, identifying, correcting inequalities in deliverance of health services, and facilitating access to community health services and health resources. So I feel like that kind of encompasses everything that I wanted to talk about in regards to being a patient advocate. So if you guys have any additional things that y'all thought of while I was talking about that, y'all go ahead and comment that down below. But I think this pretty much did a good job of what it looks like to be a patient advocate. I'm just going to get into some personal examples that I've dealt with in regards to being a patient advocate. If you guys are familiar with my channel, I did have a story time regarding a DNR patient and how she was still full code, but she was actively declining. Her sister was the power of attorney or the next of kin, and she knew that her sister would want to be DNR. So I had to talk to a doctor about that, but he gave me some pushback on it. So if you guys are interested in hearing about that story time, I'm going to link it up above so you guys can give it a listen maybe after this episode. So I definitely was like a plain out example of being a patient advocate at that time. And that goes into acting in the patient's values, culture, beliefs, and preferences, and being the patient voice. So another example I have for that is I had a patient recently who was a COVID patient. As you guys know, I've been working COVID since the pandemic began. So I know at my hospital, the policy is if the patient is on heated high flow, then they must be in isolation for 20 days. And after the 20 days have passed, they're considered to be non-contagious. So I had a patient that I went into work and I took care of, and she was like on her 24-day mark. But apparently she was diagnosed with COVID prior to being admitted to the hospital. And like it was like a week out before she was admitted, and then they tested her again when she got to the hospital. So that's like the date that they had on file. So according to the date that was currently on file, she hadn't reached her 20 days yet. So I had to get, like, she asked me about visitation and stuff like that, and I knew she was diagnosed prior to what we had in our charting system. So I got her information, uploaded it to the charting system so the provider would be aware. I reached out to the provider and I told him, like, hey, this patient was diagnosed on this date. Is she able to have visitors? And I wouldn't say he was hesitant, but more so like questioning me, because he was like, ask infection control. Now I already know the policy is the 20 days, and then the attending like can discontinue the visitor restrictions. He's on our unit sometimes, but he's not on it enough, I guess, to be familiar all the time with the policy. So I told him, like, per infection control, this is the isolation guidelines or whatever. And so I don't know why, but he was like, I'm going to discuss this with pulmonary. I don't know. To me, I kind of took offense to that, because I'm like, you had me ask infection control. I told you what infection control said, and now you want to talk to pulmonary? Like, I'm like, do you not believe me, or like, what's going on with that? But anyway, I put the link in the chat, and then I told him, like, this is how it normally goes, whatever. And then he said, oh, just got off the phone with pulmonary. Oh, it's okay for patients to have visitors. And I was just like, okay. But anyway, had I not took the extra step to like put the stuff in the system and to reach out to the doctor and ask about it, who knows how long it would have been before she was able to have visitors. Because as long as she has the restrictions and the orders, she can't have visitors. And only the attending doctor at my facility can discontinue that. So that's just an example of being a patient advocate. Like I said, I feel like it's kind of talked about a lot. So I want to get into like, how does this relate, like from charge nurse to staff, and for you being the advocate for yourself as the nurse? Because I feel like that's not discussed enough in our nursing profession. So in relation to the charge nurse and the nursing staff, this is kind of how I think of what they can do to be an advocate for their staff. By having the appropriate patients on the unit. So for me in particular, I work IMU and COVID. So there's a way, like bed management could just assign a patient to the unit, but I feel like as a charge nurse, it's your job to kind of like look through the charting to see if the patient is appropriate for the unit. Especially at my facility, it's pretty new, like with the IMU, so they're not really like good about sending appropriate patients to the unit, which means sometimes they'll send us a patient to IMU who really probably should be ICU. And sometimes the patients come up to our unit and then we end up having to transfer them to ICU like right away. This could all be avoided if you had just looked through the chart to begin with. So as a charge nurse, you advocating for your staff, you would say, hey, I don't think this patient is appropriate for our unit. This is the reasons why, whatever. And you can do it like that. As far as like COVID goes, sometimes we'll get COVID rule out patients and they're coming up here because they're being ruled out for COVID, but bed management don't always look to see if the test result has already resulted yet. So you as a charge nurse can go through the chart review and look up the labs to see if the PCR came back positive or negative. If it's already negative, you could go ahead and say, hey, the result is already negative. Are you still sure you still want this patient to come to our unit? See, at that point, it's up to them and they can say yes or no, but not because you neglected to look up the information. So I'm seeing that that's part of being an advocate from charge to staff, because it prevents the staff from having to do extra work. So sometimes, like I said, with the IMU patients, they'll come up, we'll see how they are, we'll assess them, and we're like, okay, this patient looks like they should be in ICU. Okay, now you're having to get the ICU NP and the ICU intensivist involved, and you're having to call a rapid, whereas you could have just went there. The patient could have just went there in the first place. And same thing with the COVID patients, our non-COVID patients. They could have just went to a non-COVID unit from the get-go instead of them coming up to our unit, us finding out they're negative, and then them wanting them off the unit. So now I have to send them back out after I probably already did all the admission. So that's an example of that. That's in my current facility. At my other facility that I worked at previously, they were really good about checking the charts to make sure that the patient is appropriate. Like I said, this just prevents a lot of extra work on the staff nurse part by you being kind of proactive in doing that. Another example is with bed management, again, with the amount of admissions and discharges. You know what the flow of your unit is looking like, how overwhelmed or how busy your floor is. And if possible, you could be like, oh, hey, you just gave us 2 admissions. The next nurse is still catching up on the first one. Can you hold the patient for an hour for me? Something like that. Now, sometimes they can't do that in ER, but I mean, that's different. Like you asking and them telling you no, than you just not saying anything at all. And then the admission is just coming up, and then the nurse is kind of like, I'm still trying to do this. At that point too, you as a charge nurse can step in and assist them with the admission, but in some cases, all charge nurses aren't like that. So it would be nice, all right, this is an example of you being an advocate and saying like, hey, this is going on. Do you mind slowing the amount of admissions right now? Or something like that. And like I said, if they can't or whatever, ER is busy too, then you as a charge nurse should step in and help admit the patient to alleviate your nurses. But this is kind of just being, talking about being a proactive charge nurse. Also, you could be an advocate for your staff nurses by divvying out the patient assignment appropriately. Sometimes they don't do the patient assignment, I don't want to say to the best of their abilities, but night shift might not know who's appropriate, like which patients are appropriate to give to which nurse. That being said, you know people's skill and competence level, so then you can be like, oh, hey, like this patient will be more appropriate with this nurse because she has more experience. Or it can also go into the fact where, okay, this nurse has 4 patients that are bedbound, and this nurse has all patients that are walkie-talkie. Let's split them up. or this nurse has 3 out of 4 discharges, which means she would be getting that many admissions during the day. Let's split up the discharges. So that's just some examples of being an advocate. Again, an advocate is a person who speaks or writes in support or defense of another person. So those are really just, I don't know, to me it's kind of common sense, but like I said in my previous episode, I've learned that common sense is not common. So I'm just talking about that so we can just start the conversation. Another way you could be an advocate for your staff nurse as a charge nurse is relaying staff concerns to the appropriate persons. So we've discussed this quite a bit on my channel. At my previous job, the staff had a lot of concerns regarding the unit, and we thought they were and we would tell the charge nurses about it, and we thought it was being communicated to the managers. But we found out that it wasn't. But it wasn't like the managers couldn't do anything about the said so concerns. It's just that they were not aware of them. But us as a staff, we thinking like, I guess they don't care, or like what's going on with that. But then push come to shove, they just didn't know. So you as a charge nurse can relay staff concerns to appropriate persons. That can help the morale of the unit, thus helping with nurse retention, which is a big problem right now. So I just think that it's really important for everybody to be like, let's come together and let's work together. I don't know where that is coming from, like that people don't do that, but I'm here to tell y'all to do it. It's just a part of everything. I don't know. Y'all let me know if y'all have any additional charge nurse, staff nurse, like ways to be an advocate for your staff down below in the comments. That's pretty much all I have on that topic, and we're going to move into how to be an advocate for yourself, which is really, really important, because if you don't look out for you, who will? And that's facts. So some ways that you can be an advocate for yourself: if you're not comfortable with the patient or a patient assignment, you speak up. So like I said, for instance, if the charge nurse, for whatever reason, doesn't look at the chart, is not aware that the patient probably should be in ICU, you can tell your charge, hey, this and this is going on with this patient. I'm not comfortable. Y'all gotta use y'all keywords. Comfortable, safe, like y'all gotta, I'm uncomfortable, I am concerned, this is not safe. Once you start saying that, oh, something goes shake, because if you're expressing that to your charge nurse and something happens, that kind of comes back on them. As well as if you do the same thing with the doctor. It's like, okay, well, I communicated my concerns and they didn't do anything about it. And then make sure y'all chart too, because who knows? They'll really try to throw you under the bus out here in this nursing game. Make sure y'all document everything y'all said. At this time, I told this person this, etc. Because if something happens, they're going to go through that charting to look at what was done, and you're the one charting. So make sure y'all chart. But that's a way you can be an advocate for yourself. You can be like, hey, I'm not comfortable, whatever. If they don't do anything, push come to shove, you can call rapid response. That's kind of what they're there for anyway. So you kind of be like, bump what my charge nurse got to say. I'm calling a rapid response. And then that's the end of that. Also, I don't know how you guys do your schedule, but if you are a self-scheduler, or if you're a charge nurse or whoever manipulates the schedule in such a way where you have to work a lot of days back to back, and you know that you're not the best at handling that type of thing, you can advocate for yourself and be like, hey, I'm not good with working 3 in a row. Do you mind doing 2 on and 1 off, 1 on, or something like that? Like, you could say these things. Y'all don't have to just accept what's given to y'all. Same thing with what is it? Like, if whatever you want your schedule to be, if they have a 1 on, 1 off, 1 on, whatever, and then it's just like, okay, like, I don't like my schedule like that. Can you make it? I don't care how you move it around, but can you just not do that? Like, you can say that. Now, whether or not they say yes or no, that's another thing. They might have a reasoning for it, but at least you're speaking up for yourself. And then whatever the rationale is, it's kind of like, okay, you know, because at the end of the day, you're the one that's going to have to deal with it. So you make sure you want to be at peace with it. Another example of the not being comfortable with the patient is sometimes we get demanding patients or patients who require a lot in terms of medical stuff. So if you're back for a consecutive day, you could say like, hey, I really think this patient should be rotated because they have a lot going on. And that's a way too, because if not, they'll probably just give you that patient back and think nothing of it. But you're like, no, I did this for a day. I'm good. Like, can you switch me with somebody else or whatever? Like, those are ways you can advocate for yourself. And in the end, it's going to work out in your favor because maybe it's uncomfortable for you to speak up while it's going on. But like I said, you're the one that's going to have to deal with this stuff. So you want to make sure that you're okay with that. And then by you doing this, it also helps to prevent from burnout. I feel like part of burnout is people not speaking up for what's going on with themselves. Like I said, with the previous categories, if you guys have any additional ways on how you advocate for yourself, go ahead and comment those down below. I'm interested to see what y'all apply in y'all nursing profession because maybe I need to apply it. So y'all let me know down in the comment section. And lastly, we're going to get into how do you become a better advocate. So I feel like in order to become a good advocate, you need to first be informed. We can apply this to all of the categories. Informed on the patient's condition with extra information. You know what's appropriate, what's not appropriate. You know what their values are, what the belief system is, what they think and what they don't think, what they said about this, what they didn't say about that. Also, being informed can cover you knowing the policies and procedures of your unit or your hospital. So then you're able to say something about it because you have knowledge, basically. Next is understanding. So I think once you're informed, like you could know something, but you could just simply not care, especially when it comes to patients. So if you're informed of something and you know that they have a concern, like you understand, like this is a big deal to them. So they need to know. They don't care about this other stuff, but they care about this. So you need to be understanding. So then you kind of have a passion or a drive to go forward with whatever you need to tell the doctor or whoever's the appropriate person. And then lastly, I think in order to be a good advocate, you have to be assertive. So you have to be like, I guess you can also say communicator too. I didn't have that listed, but with being assertive, we learned about this in nursing school. There's a way to say things and there's a way to speak. This is just a part of growing up too, but we're all in different places. So like being passive aggressive, I feel like eventually kind of backfires on you because not everything is stated and you're doing it in like I don't want to say conniving, but kind of like, it's like you're saying it, but not saying it. And then with being aggressive, it's just kind of like, okay, now you just doing too much and nobody's going to listen to you because of how you're saying things. But being assertive is kind of like the perfect balance and you know how to speak correctly or in a way that people will listen to you and you're able to communicate and use the right words in order to express yourself and express the patient's concern adequately. So I think that those are some important characteristics to have in order to be a good advocate. So if you see like, maybe I should work on this a little bit more, or maybe I should work on this a little bit more. I mean, all of this is going to help you in the end of the day become a better nurse. And I think that's what we all want here. So if y'all have any additional things to add to anything that I said throughout this episode, y'all go ahead and comment down below and we can start a conversation in the comment section. I just definitely wanted to bring this up because not everybody knows what advocacy looks like and how does it apply and how do I become better at it. So I definitely wanted to touch on this on my Talk Nurse With Me episode. So if you guys like my content, go ahead and like this video. Support your girl, okay? Subscribe to my channel if you have not already. And then, like I said, comment down below if you have anything you would like to add. If you agree, if you don't agree, it's cool. It's all love here. We're just trying to become better nurses at the end of the day. And I will see you guys in my next video.